to the Inside Story Hunters podcast. This is Lori with a story. This next episode is absolutely a game changer for those that have been suffering with chronic depression, anxiety, opioids, and all kinds of medications just continue to mask the pain and the suffering that individuals are living with, that have had some sort of injury, PTSD, people that have served and protected us in the military and come back and are no longer the same person. Ketamine has such superpowers that I'm so grateful for Dr. Malchow allowing us an opportunity to capture some of his inside story today. So please stay tuned and be sure to subscribe. And we give a big shout out to C&R Services for sponsoring this episode today. So hang on and here we go. Well, good morning.
Good morning.
Thank you so much, Dr. Malchow, for being with us. The Insiders, this is Dr. Malchow from AMG Ketamine and Wellness Center at 1909 Mallory Lane in Franklin, Tennessee. Wait till you hear this story. My life has been changed since I've met you, since I've met your staff and some of the patients. It's just unbelievable. We're here today to put a voice to ketamine.
Yeah.
But so Insiders, welcome to the Inside Story Hunters podcast, and we just you need to be tuned in. I hope you're watching, listening, and Dr. Malchow, again, I'm honored. I'm intimidated to be sitting next to you because the way that people talk about you and the care that you're providing, and I just wanted to take a few minutes and did some homework and just read a little bit about you, and then you just correct me or add to it, but your story is just unbelievable. So thank you for being a life changer.
Thanks for letting us be here and sharing our story with you. Thank you, Lori.
Absolutely, and being a lifesaver in all that you do. So, but Dr. Malchow, you've been an anesthesiologist for over 30 years now. 25 of those years in the armed forces. So a military, and you retired as a colonel in 2008. So you must have been 4 years old at that time.
Long time ago.
Well, that's it.
Yeah.
So, but the fact is, I see a pattern. So, I mean, Nurse Dawn, military, that you all have served and protected us for many years. But now you're doing it from the place with the help of ketamine, the superpower of it.
Yeah.
So, and then you became an associate professor for Vanderbilt University Medical Center. In 2015, established one of the few ketamine infusion centers for the Veteran Health Administration. And that I want to dig into for sure, because why is it only a few?
Yeah.
That upsets me.
Yeah.
So, but today we're here to be as cheerful as possible, but I really do hope that, Doctor, you'll take us through this journey. But there is a part of the story that I couldn't find anywhere, and I call that the inside story.
Yeah.
So you get to decide, but I would love for you to let us into what's it like to be Randall.
Yeah.
I mean, you're a doctor. It's incredible. It's important, and I want to show respect to your credentials and your experience. But why anesthesiology?
Yeah.
Why didn't you just become a professional baseball player?
Yeah. Well, anesthesiology really lets you in on service and hearing from patients, and there's so much pain and suffering out there, and it allows physicians and nurse anesthetists to really get involved in patients' lives in a meaningful way, whether it's in the operating room or in a pain clinic or in a wellness clinic like this, in a very unique and powerful way. Lori, there's so much pain and suffering, not just in the United States, but around the world.
Yes, sir.
And it breaks my heart, and to see that. We're fortunate to be here in Williamson County in Tennessee, and we're blessed with so much. But we recognize that it's we want to pay it forward and serve others. And so God's given us all gifts and talents and opportunities, and I don't think those should be wasted.
No.
And so this is a way to try to make a difference. Yeah.
But that's what we're here to be purposeful, touch lives, influence, make a difference, right?
Yeah.
And the fact that you choose to do that every day, does it take a toll on you?
Yeah, I think anytime you get personal to a certain extent with patients, and again, healthcare in the United States has become a business, frankly. It's a fast-paced business where patients are no longer patients, but they're customers. And so we elected to go back to the old-fashioned medicine where we're going to get to know people. And we're going to really address what the issues are and try to make significant transformative changes in their lives. So to do that, though, in order to do that, it's going to require connecting with people in a personal way. And so
we need it more than ever.
Yeah, when you do that, you're going to expose yourself and you're going to carry some of their burdens with you. And sure. There is some heaviness to that, maybe. But it's important. It's important to be able to connect with people, and that's what we're doing. Yeah.
Take me back to, why did you become an anesthesiologist?
Yeah.
A little bit more of, the growing up and the military. Was there a defining moment that's the decision you made to go that route? Generations, multi-generations went into the service, the Air Force, the Army, or a little bit more of that.
Yeah, right.
Because I'm here to capture more about Randall.
Yeah.
You see, I'm not going to let that go.
Yeah, got it.
Because you matter so much,
Yeah.
you influence your living.
Yeah.
So I really want people to know more about the man that's going to sit next to them during these ketamine treatments.
Yeah.
Guiding them, protecting them, nurturing them, keeping them safe.
Yeah.
So who are
exactly.
you?
Yeah. Well, you're exactly right, Lori. So, when I go back, way back to college days, I was at a military academy, and the purpose of that military academy was to produce warriors. And the more you reflect on your character and your purpose in life, the more I thought, well, I don't know if I am a warrior, per se. And I'm glad there's folks that really, we need warriors. We need people to defend righteousness and the innocent and the unprotected. So I thank God for warriors. But I also, when you do some self-reflection and you think, okay, is that me? And so it really pushed me into medicine, frankly, and how can I contribute in a meaningful way by supporting the warriors. And so it brought me into medicine, and then anesthesiology was, again, that's you start to think about what specialty is going to work with your personality and your gifts and talents, and biochemistry and pharmacology and procedural activities, working with your hands. That's all part of anesthesia, and maybe that was the initial draw. But as you get into it, again, when patients go for surgery, it's terrifying, and they're worried about not waking up, and they're worried about serious issues as a consequence of surgery. So this is an opportunity to serve and at a very vulnerable time for patients.
Yes.
Their
life is at stake.
Yeah, they're exposed, and they're in a real raw way where they're afraid. And so to be able to come in alongside patients and say, we're going to get you through this. Set your fear aside, and we're going to get you through it, and you're going to do fine. And so it was an opportunity to serve and reach out to patients that are suffering with pain or emotional stress, and get them through a difficult time. So.
And here you are today doing that with the help of ketamine.
Yes.
And go ahead and
propofol.
Yes,
Yeah,
which
exactly.
I understand needs to be married together for the peace that it'll bring. Would you take us through that?
Yeah. Well, one of the side effects of using ketamine is, as the audience may know, is a psychedelic medicine, and it's part and parcel with ketamine. Ketamine's an amazing medication. It does things that frankly no other anesthetic or medication does. It's powerful. It's a powerful tool, but it is a psychedelic and what we call a dissociative anesthetic. So We, in our protocol, we tend to use some sedatives just to quiet some of that disassociation down, so that we don't want this to be a negative experience. So propofol allows us to either push the dose a little bit more, where we can do that reliably without getting into some side effects, negative dreams or thoughts. We can quiet that down. So the use of propofol makes it more pleasant. I would say the risk of a bad thought or dream would be in the 1% range. And without propofol, it would probably be 10 or 20%. All of that being really dose dependent on how we approach it. Yeah.
Which brings me to a unique about your team, because not everyone approaches it this way. So would you elaborate on that? What distinguishes your team from how other ketamine, and we're not judging it, we're just simply saying the power of how you approach it.
No, I appreciate the question, because frankly, there's a lot of ketamine infusion centers that are opening up, and everybody says, "Oh, we can do this, and let's jump into the business of ketamine administration." But we believe that as an anesthetic, it's important to have an anesthesiologist involved. That with a lot of experience and use of ketamine, understands ketamine, board certified, and so forth. So we think that the physician component of this, we don't want to just throw medications at people. We want this to be a comprehensive medical approach. So that's going to require medical care and getting involved from a comprehensive history and physical, and treating the patient as a patient, and not just giving them a drug. So we think the physician component is important. You mentioned the propofol, Lori, and again, we're probably one of the few centers that uses propofol and other sedatives, and again, we think that's important to make it a more pleasant experience.
I would assume it also encourages people to have additional treatments.
Yeah.
If I have you Debbie, who we had timed together, if it had been a horrible experience, she may not go past the first treatment.
Absolutely. And you can get by without propofol if you keep the dose low enough. But there's also something we call a dose response curve. So many drugs have that, where we increase the dose, we have a little bit more efficacy in our outcomes to a certain point. And then there's a ceiling or plateau of that effectiveness. But unless you push that dose a little bit, you're not going to know exactly where that patient is on that dose response curve. So it's going to require some flexibility, some adaptability, and willingness to increase the dose when it's appropriate. But in order to do that, you're going to have to be able to quiet some of the potential side effects. So sedation, we think, is important. And then the third thing would be monitoring. So we monitor our patients just like they would be at a surgery center. And again, we think that safety is paramount, obviously. We take that extremely seriously. So there's full physiologic monitoring from EKG and blood pressure and pulse oximetry and oxygen and carbon dioxide monitoring. So we have a very good feel for what's going on with each of our patients. We want them to feel secure, that this is a safe place. That's the last thing they have to worry about, is whether or not that they're being at risk. And another thing that I would say distinguishes us is that we have one-on-one nursing. And you talked Dawn today, and Dustin is our other full-time nurse. Both of them are just fabulous, and frankly, the nurses that we have here are just top-notch, just super experienced. And I can't say enough good things about them. So
when you hear their stories, it makes you cry.
Yeah.
Because they're so beautiful.
Yeah.
Inside and out.
Yeah.
But they feel the same about you.
Yeah.
And it's just not a lot of places that create a culture and an environment in that way. And when people are here and they're debilitated and paralyzed and depressed, and the anxiety has ruined their lives. And connected to them.
Yeah, and there has to be. A team is a team, and it's only effective as you know. The outcome is going to be only as effective as how well that team functions together. So if there's dissension or misunderstandings, everyone's got to be on the same page. And whether it's in the operating room or whether it's here in this wellness clinic, so we take that seriously, and I'm just so thankful that we've got a strong team and that we are patient focused. And that's where it starts. And so, and I would say the final thing that really kind of distinguishes us is the wellness. So this is AMG Ketamine and Wellness Center. So that means that, again, we're not just going to ketamine. It's bigger than that. And the wellness component is very important for us. And what we tell patients is that the ketamine can get you feeling better, but it's the wellness component that's going to make a long-term difference, and where there's less reliance on ketamine and more long-term changes. And so we integrate a very personal wellness plan that's specific to each and every patient. And again, I think that's probably unique on how we do that.
Would this be a time that we would be possibly touching upon, or a great way to introduce the NAD infusion treatments? Because when I read up on it, I couldn't believe the benefits from the place of if someone was insulin deficient, that we're talking about diabetes then, we're talking about the benefits of the nutrition that, right, for Parkinson's disease, Alzheimer's, but the vitamin that, if you'll just talk about it.
So, some changes, biochemical changes that go on in patients with depression or pain, is that we have some neural connections that aren't as healthy as they should be, frankly. And so you start to develop this brain fog, this fatigue, this lack of focus, lack of concentration, lack of interest in your normal activities. So that's a common theme with our patients. And
with a lot of people in the world today. Sure,
absolutely, yeah. So NAD, and we don't have the time to go into the biochemical structure and what it does, but suffice it to say that inside our cells there's little mitochondria. Perhaps the audience is familiar with that, but mitochondria is where our cells produce energy. And the currency is ATP, and that's the chemical that's used by our cells for energy. So, but within that, and again, the biochemical changes are complicated, but NAD is an important enzyme and cofactor that's part of that production of ATP. And so our NAD stores get depleted. And NAD infusions can be very helpful in restoring that energy production and allowing us more interest and focus and less brain fog. It's also associated, and there's some great research in the last 20 years looking at alcohol addiction and craving, and opioid craving and addiction, and the use of NAD for that.
Unbelievable.
And so one of the missions here at this clinic is that we treat chronic pain and opioid use and dependence. And one of the big tools we have is NAD. And NAD, along with producing that energy, also decreases some opioid craving and alcohol craving. And again, people self-medicate at home. You know, they're not feeling great. They don't know what to do. They lose hope. And so they turn to a glass of wine, and then that turns into 2 glasses, and then 4 glasses, and then pretty soon it's a bottle. And so they just need help. And how do I turn the ship back and right the ship a little bit? And NAD can decrease that urge to reach for that bottle and make better decisions, from a wellness standpoint.
As compared to going to rehab, when the conditions or our disease takes over us, could you possibly elaborate on that? I mean, when, if someone comes in here and they're on the verge of going to a rehabilitation center, their life has been debilitated, they're paralyzed, they're just not operating on all cylinders. When is the right time for a ketamine treatment?
Yeah. Well, and that's a great question. If there's a serious substance abuse problem that's going on, and again, some of that oftentimes coexists with our patients. But if it's a serious issue, that probably ought to be addressed before we start on ketamine infusions. So, for a lot of reasons, but. One of the things that we think is important is this collaboration and communication and co-management with other providers. We don't have all the answers, obviously. It takes a team to approach complex patients. Ketamine is part of that effort. Some of the tools we use besides ketamine and NAD, we have other tools that we have available to help addiction. And so it does take a team. But yeah, we're in no way suggesting that we're going to replace rehab centers. There's so many fabulous rehab centers, and they're critical. They're critical to the piece, and we're not suggesting that we're replacing them. But there is a place for what we do that can contribute to that effort for sure.
So we're talking to an audience who we can't really physically see, but we hope they're hearing us and watching us. But to the insiders, if someone said in like 1 minute or less, not that I'm putting pressure on you, I'm not timing this, but we're just like, what's the power of ketamine? And when someone says, tell the short story, Lori, of who it's going to impact, what's your the first, what do you bring forward in that minute?
So
absolutely. Important about it.
Well, when we look at the indications for ketamine, we're talking about mental health and chronic pain and opioids. And so we talk about this triad of depression and anxiety and pain, chronic pain, and they coexist. They cohabitate, if you will. And so when you try to treat just the depression or just the pain, you end up kind of chasing your tail a little bit. And ketamine is the only treatment that I'm aware of that treats all of these things simultaneously in a powerful way.
That is such an important statement that you made. It really overwhelmed me as you said it. Because you're right, we're focusing, it's like fixing, you broke your hand, we'll just focus on the right finger, and then the next one, and you didn't fix my hand.
Yeah, and they're so codependent. All these issues are codependent on each other, and so you can't separate them. They live together. And so ketamine, and we're just so thankful that research has been done to bring this to the forefront, to allow clinicians to be able to do this. It's a powerful tool that addresses things simultaneously, and that's really it.
Amazing. Yeah. Absolutely. So I want to read a few of the testimonials, not word for word, but I highlighted some that of all ages. Dr. Malchow, you have impacted, and your team. I know you say it's a team effort, but I really want to just spend some time and focus on you. Being a life changer, a lifesaver, the people are so grateful. And the testimonials just over and over again talking about the impact and your kindness and the time you spend to sit with someone. An hour and a half, whatever it takes. Yeah. Amazing. So here's a testimonial woman. Her name is Billy. She said her life had gone very dark and deeply depressed, one-to-one, that today it's bright, glorious, full of hope, joy, light, laughter, and optimism. And it's due entirely to the ketamine infusions that I received at AMG, along with the loving and compassion care that Dr. Malchow provided, and the phenomenal staff. But she just continues to go on and talk about this. And she's age 65, right? And suffering for years, and finds the solution. Like you're the magic, the secret sauce. And then Fisher, and he's a healthcare professional who needed the evidence, the studies, the research, and the peer-reviewed medical literature in order to support this before he would even consider it. And then he just exudes over and over overwhelming accolades to you. Reed, 27 years old, couldn't get out of bed. Just extremely, today, because of the way you listen to him, he said that Dr. Malchow, that you listen to everything. You don't judge. You create a plan that's totally aligned with him. And you encouraged his health to come back alive, not just his mind and take away depression and anxiety, and that he had that you got him out of bed, that he's alive.
Yeah.
And prior to that, barely getting out of bed, and he's active, he's smiling, he's laughing, and it just goes on and on about it.
Yeah.
I mean, how do you take that in?
Yeah, well, I think our whole team it just feels honored to be able to take care of patients, and when we see profound changes and reintroduce hope into people's lives, it shakes you to the core, and it reminds you how special life is, and what an opportunity it is to come alongside people who are hurting, and try to structure a plan and a way forward from the darkness to the light, and that's a privilege. It's an absolute privilege. So again, these patients are not customers; they're patients, and and frankly, friendships develop where they trust us, and we trust them, and it's a partnership of going forward with renewed hope that there's a future ahead of me, and life is short.
The way that you said it, even the tone of your voice, your energy to be near you, immediately makes you feel safe.
Yeah.
So I haven't gone through a ketamine treatment, but I could only imagine how to feel cared for.
Yeah.
But he made me actually think: is the word patient really, does it derive from patience?
Yeah. Perhaps it does. Exactly.
Because when you said it, it just hit me. I thought, well, he's talking about. You said they're patient.
Yeah.
So it's patience.
Yeah. And that that's getting back to that time factor again. I'm embarrassed to a certain extent that healthcare in the United States is where it is. It's this incredibly lightning-paced system where we spend more per capita on healthcare systems than any country in the world, yet our life expectancy is ranked 46 in the world.
Wow.
And that's just
Say that again, 46.
We rank 46 in the world. In fact, since 2014, our life expectancy in the United States has decreased each year. That's for a lot of reasons, whether it's the obesity epidemic and the opioid epidemic, and where we are with mental health and depression and suicides, but that are an all-time high. But why is it that we've got this system that costs so much, yet we rank 46 in the world, behind countries, Panama and Cuba and other much smaller countries with fewer resources?
There's no reason for it.
There doesn't seem any reason for it. So to me, that tells me that we're not spending the time we need with patients. Patients want to be heard. They don't want to be rushed in like cattle and in and out in 2 minutes. They have a story, and we have to figure out how are we going to take the time to hear their story, and how are we going to address their specific issues in a meaningful way that's not a Band-Aid.
So well said. What can we say today to insiders? What do they need to hear? Obviously, we should tell them how to call into the center, and that the phone number is 615-813-5006.
That's right.
Or the website at amg-ketamine.com.
Perfect.
Right?
Yes,
okay,
you got it.
And then you want me to remember your email address, which I cannot, but I can. I know I have it written down, but it's Randall, RANDALL. Malchow, which is MALCHOW at AMG-ketamine.com.
That's exactly right.
Right.
Yeah.
So on 1909 Mallory Lane in Franklin, Tennessee, AMG Wellness, Ketamine and Wellness Center, which I'm curious, you're a medical director, and you're a part of a conglomerate, right? It is the largest, I believe, anesthesiology group in the U.S., AMG, or or no, am I getting it wrong? You're AMG.
Well, Anesthesia is Anesthesia Medical Group, and FIMED is the other company name, I guess. But I don't know exactly how it ranks in terms of size compared to other physician groups.
Well, we're going to go with the largest. Okay?
But
somebody on the insider will tell me I'm wrong. But it's
but it's a group of professionals that I'm proud to be associated with. Yeah.
Hospital setting versus clinical. totally different worlds.
Yeah, for sure.
What's it like to be here?
Yeah, exactly. It's you're right, totally different world. And the difference is one of the reasons that drew me into this kind of work. But when you're in the operating room, of course, it's very fast paced. Everything is boom, boom, boom. Let's go. And there's limited time to get to know people, and people are hurting, and they cry out for support, and it's going to be difficult to hear them in a meaningful way, just given the production pressures that exist in the operating room, and probably throughout the hospital system. A wellness center like this is going to give you the time that you need to take care of patients.
Does it make you happy to be able to have that time? Obviously, we talked about it.
Sure. Oh yeah, absolutely. And it's more than happiness. It's a deep inner joy. That it's not just patients that are tired and stressed, but providers and doctors are tired and stressed, and so you've got this whole group of people that are just worn out, and nobody can give anybody any time anymore. And we've got this fast-paced social media world that time has gone away, and so
it's a blessing and a curse. Even now being a new podcaster at this point, but the gift will reach larger audiences. Maybe give a voice to ketamine today in a very grand way, but at the same time, the beast of it.
Yes, yeah, no, and that's a great point. Technology is fantastic in so many ways, and we all have become dependent on technology.
Yes.
But somehow we have to be able to say, okay, when it comes right down to it, we're still people.
Yes.
People that need other people.
Yes.
And we have to be able to still connect. And sometimes I worry that technology is not brought people together, but it's separated us.
It is. I always say I'm going to leave this earth physically, being the person who still needs this.
Yeah.
I want to be able to reach over and say hi,
exactly.
or hug someone. Right? Even during COVID time, I found ways to hug. Okay? Safely, of course. But, but still, it's almost go back to what you were talking about with the anxiety and depression and so forth, the triad, where it's all married together.
Yeah.
It's the same. To be heard, it's one thing to listen. And to speak, but to be heard.
Exactly.
To truly, when you're sitting with someone and it's, you're preaching to the choir, like, it's the inside story that I choose to call it. Yeah. And it lies within each of us. Yeah. We were each born and divinely, created through God's eyes, and to be me, to be Lori, right? But inside lies a story that it makes me sad to think there are so many that have left and we didn't hear it when we needed them.
Yeah, for sure. We've all been there, whether it's a family member that goes to see a doctor or a nurse or a healthcare provider, and we feel that we're not heard. Yes. We leave the place feeling empty, that I wasn't heard. They didn't hear me. I was speaking, but they didn't hear me, and it was just a knee-jerk, this is what you need, here's your prescription, go.
Maybe 5 prescriptions, right? Just in case.
Let me sprinkle that with some.
Just in case this one doesn't work, here you go, here's a variety.
Yeah, that's right. That's right, yeah. So, I can remember way back in medical school, just a few years ago, but I remember one of the important points was that the assessment, the diagnosis, 80% of your ability to come up with an assessment or diagnosis comes from the history of the patient. So it's not a lab work, it's not a test, it's not an MRI, it's listening to the patient.
And if that's not happening, doctor, how are they getting the information?
Yeah. So if we just say, hi, how you doing? I'm going to send you over here for a CAT scan. We're missing the story. We're missing the story and the testimony, and that's where the active process of coming up with a plan. And if you don't have an accurate diagnosis, then you're kind of just going off in 100 different directions.
Or you're traveling for years through this world, this journey, and like Debbie Tropower, 9 years? Yeah. To walk into your office, go through a ketamine treatment with her husband present, you're present, one of your nurses is there, and she says, I already feel the difference in 1 hour.
Yeah.
9 years of unnecessary suffering.
Yeah.
9 years.
Yeah, for sure.
That's just 9 minutes is too much.
Yeah, exactly. It's exciting work, and we're happy to be part of it, for sure.
Well, I'm very grateful to be sitting here today, to have an opportunity and be privileged to ask you to share a bit of the story.
Mm-hmm.
But is there any final words that you'd love to tell the insiders that they need to know about you, about the staff, the center, ketamine?
Yeah. Well, I would just say that for those that are suffering from whether it's mental illness with depression, anxiety, PTSD, OCD, opioid dependence, alcoholism, chronic pain, I don't want folks to lose hope. That's our message, is that don't feel like there's just darkness in front of you, that there is hope, and reach out to us or others that you trust, starting with your primary care provider, and have these discussions. That's the main thing. It's just let's get away from the self-medication and I'm going to just fix this by myself.
There's a community here.
Mm-hmm.
There's a family waiting for you to embrace you and take you in, and to support you, and to answer your questions and guide you, and to make you feel at ease, and to know that you're in a safe environment around safe people, to safely be able to share. Let us in and bring you some support. So again, today we're on site here with Dr. Malchow of AMG Ketamine and Wellness Center, located at 1909 Mallory Lane in Franklin, Tennessee. And there's just a magical group of people here just waiting to meet you. Or if you'll spread the word and let someone know about ketamine. Yes, it's been around for a very, very long time, but in most of us, or in most of our worlds, I didn't know about it just till a few months ago. Yeah. And I'm not going to stop putting a voice to it. So thank you again for today, and being a life changer and a life saver, and just being an amazing human being.
Well, Lori, thanks so much for coming, joining us, and letting us be part of your program, for helping us get the word out. We are immensely grateful for that, and we wish you all the best as well.
Thank you. You'll be able to see this episode on Inside Story Hunters, on whatever podcast platform that you listen to or watch. So please, or go to LoriWithAStory.com and subscribe and check out the website. Of course, you can reach Dr. Malchow, or learn more about the AMG Ketamine and Wellness Center at their website at amg-ketamine.com.
That's right.
So please put the word out there. Let's save some lives. Let's help some people. And if you need it, we're here for you. And have an amazing rest of the day.
Yeah. Thank you.
Bye for now.
Take care.